Hi, guys, it's Dr. Sadaf, and I would love for you to like and share this podcast and make sure you leave me a review. I'd love those 5 stars. So please, when you send me a review, please make sure to put the 5 stars in and to share the episode with somebody that you know that could really use it. And I would absolutely appreciate it. Also, if you're looking to schedule an appointment with me, make sure you go to my email and put your name on the email list. You will be the first to know when I open up my office in spring of 2024. It's drsadaf.com. And last but definitely not the least, September 16th to the 23rd, 2024, I will be hosting a retreat with Dr. Basma Faris in Morocco. You will be getting yoga and coaching, and we'll be doing excursions and cooking and spa and hammam and all of that great stuff along with meditation. So make sure you don't miss out. Spots are limited. So go to the link in my bio in both Instagram and TikTok to make sure you register. Enjoy the show. I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi, and this episode is everything you need to know about cognitive behavioral therapy and its uses with perhaps past trauma experiences or difficulties with intimacy and all of that good stuff. Before we get started, I want to make one thing very clear is that I'm not giving any type of medical advice. So if you have any questions about your health, please speak with your healthcare provider. And if you have any questions about it, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So I am so excited to have on with me today Dr. Sanjana Karim. Dr. Karim joins us from the Bay Area in California. Welcome, Dr. Karim.
Hey, I'm so happy to be here. Thanks for having me on.
Yes.
And thanks for covering this really important topic.
Yeah, thank you for coming on. So please, for all the listeners and viewers out there that may not know you, please introduce yourself and tell us what you do.
Okay, so I'm Sanjana Karim. I'll tell you a little bit about my background. I did my undergraduate studies in biology, Africana studies. I got my medical degree from Georgetown University, and I went on to do residency in psychiatry and a resident fellowship in public policy from George Washington. I'm dual board certified by the American Board of Psychiatry and Neurology, as well as the American Board of Preventive Medicine. I'm the founder and director of Peachtree Mental Health, a psychiatry and psychotherapy practice in the San Francisco Bay Area. I see people, patients in the Bay Area, as well as through telemedicine throughout the state of California. I have additional training in psychodynamic psychotherapy, cognitive behavioral therapy, trauma-informed therapy such as EMDR, addiction-informed therapy, and I am also trained in traditionally integrated Islamic psychotherapy.
Wow, that's amazing. That we needed like a whole podcast just for all of your credentials. That's fantastic. Wow. I had no idea you were so really well overqualified. So this is fantastic, amazing. So tell me, I know that, as a coach, so I'm a coach and I do intimacy coaching. And oftentimes what I see is, patients that have sex negative beliefs, right? Oftentimes they'll exhibit those in their bodies. And when they try to become intimate with somebody, their body reacts and then they're not able to. For example, case in point with vaginismus. I've talked about vaginismus a few times on this podcast. And I think that vaginismus is a really good example of what can happen when we have either experienced trauma or we hold sex negative beliefs, whether or not we're aware of it, but our body anticipates the fear. And for those that may not remember what vaginismus is the tightening of the muscles in the vulvar region in anticipation of pain due to fear. And that fear may be due to the sex negative beliefs that they grew up with, or like I said before, it could be the trauma that they experienced, and so then that shows up in their body when they're trying to become sexually intimate, or even just having a pelvic exam or putting a tampon in, any of those things, right? Those your
It
body
all
is
triggers some of these
right,
same
right.
physical responses.
Exactly. So, I'd love for you to explain perhaps the psychodynamics of what exactly is going on and how cognitive behavioral therapy, because that's usually what I use to help
Mhm.
patients
Yes.
that have these issues. But I'd love to hear your take.
Sure. I mean, vaginismus and a lot of intimacy related physical challenges are a really good example of the duality of the mind body connection, right? There's a psychological and a physical component to this. And this is a very common issue I see, not just in the Muslim community, but in general
Oh, yeah. Yeah.
amongst women. And there's very often trauma associated with it. There's sexual trauma, and then also there's women who've grown up to or come up in society or in their families to have a negative understanding of sex sometimes, and that can become very challenging when they're in a marriage and when they're in a sexual relationship. And I'll tell you a little bit about what the cognitive behavioral therapy for this looks
Yes.
like, and
Please.
what cognitive behavioral therapy is. Actually a good way to describe it. There's two components to it: cognitive, where we kind of talk through it logically and understand kind of logically the beliefs people carry and how that affects, and the behavioral component, which is the automatic emotions, the automatic actions and responses people have sometimes. And there is a very strong behavioral component to this. And that is sometimes a large part of where we focus on in cognitive behavioral therapy and CBT for issues like this. For example, if we kind of go a little bit more into the neurobiology of it, we talk about there's two components: a shame-based and fear-based conditioning. Um, and the part of the brain that holds a lot of fear of survival, and holds those fear memories, is the amygdala. And how you respond to a memory that's triggered in the amygdala and that fear-based part of the brain is very different from where we um, how we respond to memories that are held in our cognitive, our higher functioning brain, the hippocampus, and also just in general, like our frontal lobe or our executive functioning is more in charge when we have memories that are kind of just factual, and memories that are not very very emotionally loaded. And the amygdala brain, that's kind of also where the smell receptor sometimes triggers it as well. And trauma, it's there to protect us, right? When the caveman first saw a bear or first saw a predator, the smell, the sights triggers the amygdala. And after a trauma or after some sort of traumatically held beliefs, when that part of the brain is activated, the responses physically and emotionally happen. It's 0 to 60 right away, right? So a lot of times women come and they say, well, I don't know, like I can't even get started with some of these actions because the response happens before I even think about it. I have the physical response. I have the vaginismus. I have the heart racing. I have the immediate emotional response that I don't want, and I want a different emotional response. So, so how do we re-gear that, not just cognitively, but especially emotionally and behaviorally? And a large part of that is looking at it through processing these stimuli differently. And a huge part of what we don't hear enough about is, for women, physical and emotional intimacy is much closer linked than for men. And especially women with trauma or sex negative beliefs, the idea of emotional intimacy and building emotional intimacy with your partner is so important. And we've always heard, it's good to have those times where you're building emotional intimacy, having times where you're talking and being playful with each other. And there's a huge emphasis of it, even in our deen. If you go back to our traditions, even in our early scholars, in terms of مختصر منهج القاصدين. So if you go back in our tradition, even to early scholars, in books such as this, we discuss they discuss sexual etiquette and building character through how we interact sexually with our spouses. And some of the directives are really to build playfulness between the spouses, and we're not just talking about physical playfulness but emotional playfulness. And if we look at the intimacy that was there between our Rasulullah sallallahu alaihi wasallam and his wives, he things like when we hear that he let them comb his hair, they fed each other, they played with each other, he raced with Aisha radiallahu anha. And we think about these, and we think about how we think so much more formally about the husband-wife relationship now, about the sexual relationship now, and that's kind of not that's not necessarily sexually healthy. Sexually healthy is to really build that emotional intimacy and really see that as the gateway to sexual intimacy. And that does do a lot in terms of separating the automatic behavioral responses that trauma may have created to sexual acts. And then the second part, the playfulness that goes with physical intimacy, and then having foreplay. There's not enough emphasis sometimes on foreplay when people are thinking about being newly married or having sex for the first time after their wedding. They're thinking about going right into it, and they're not thinking a lot about foreplay, thinking that you have to be experienced and you have to know a lot about this. And women are sometimes even told off against foreplay. And if you kind of go back to our old text, talks about men really emphasizing, especially for men, that for women, foreplay is very important, to always spend a lot of time in foreplay to make it comfortable for the spouse. And the idea of really exploring early on in your relationship, and really at every stage in your relationship, what you like, what you don't like, and expressing it to your spouse is really important. And these things really do help decouple that trauma reaction with sex. And then slowing down when you do notice that there's a quick response happening, backing away and really building that emotional intimacy again and going back to foreplay. These are important things. And then also the other emphasis that was made, and there's no haya in deen. The other emphasis is on continuing playfulness and continuing some of the act after the man has reached completion, because there is emphasis on the fact that sometimes it is more challenging for the woman to reach her completion, even if it's the second time around, and to not finish the act until you've provided for your wife as well.
Right.
So
Wow.
these things are very important. And
Yeah.
then in terms of for women who do have a very physical response, the idea of gradual desensitization, slowly having acts proceed very, very slowly, and having small exposure to the sexual acts and backing away, and kind of rewiring the brain for sex and rewiring the brain for positive intimacy.
Hmm. It's fantastic. So you've said so much, and I'd love to unpack that a little bit. So you talk about changing the thoughts that then will change your feelings, which will then change your actions as to what happens.
Exactly. It's kind of like the base model of CBT right there.
Right.
And
Right.
sometimes it's like thoughts, feelings, actions. That's more of the cognitive component too. But the behavioral component sometimes just runs very quickly, right? That's the part we have to sometimes explain to women too. It's not just kind of talking through it. So a lot of times talking through it is very important. The thoughts, behaviors, actions, reprocessing it with a therapist, reprocessing it with someone who you trust, is very therapeutic, because that is something sometimes people aren't very sure about. They'll come to me and they will express doubt. Like, what if I bring some of these negative beliefs to the forefront, or if I bring some of these negative memories of my past or traumas of my past, will I not be worse off? And the truth is, yes, you do have to have someone who's experienced, who knows kind of how to have someone process it in a safe way, that doesn't trigger relapses in terms of worsening of their current state or worsening of their emotions. But they're even neurobiologically, we can see why cognitive behavioral therapy makes sense for traumas. And you have to be very careful with sexual trauma, because it can lead to re-experiencing. But if it's done correctly, what it does is you actually recode the memories. Very often we've seen it even in studies, that you kind of recode it from the amygdala doesn't light up anymore as much when you're looking at PET scans of the brain. Yeah, the other parts of the brain, the higher brain, lights up when you're thinking about sex, when you're thinking about intimacy. Whereas in the beginning, the fear center is lit up, and that leads to like that fight and flight response, and that leads to that fear-based response. And very often, women aren't really conscious of it being a fear-based response. Sometimes they say, I was really doing well, and then the vaginismus just started up. But it's not, there's not a thought process that leads to it. It's sometimes a very simple memory. It triggers a memory, it triggers a response, it triggers a fight or flight, and that also can be retrained.
Mm-hmm.
So that's a little bit different than the cognitive component. Although the cognitive component in therapy is very helpful too, because then you're kind of addressing the root of the issue. You're actually slowly recoding it somewhere else, and so that you're less likely to get that automatic behavioral response.
Mm-hmm. It's fantastic. You had mentioned earlier about basically in Islam how important it is for both of the spouses to experience pleasure in their relationship. And, that's something that I think a lot of people that are Muslim, one, probably don't even know about, to be honest, because I feel that a lot of us don't really know our Islamic history with Islam and eritology, right? There was this strong connection, and there was even a book called Ilm al-Ba, which is about eroticism and Islam's relationship with it. And there are lots of scholars in history that have written books about it and about the importance of both of the partners being satisfied. And you also spoke of a tradition of the Prophet, peace be upon him, that talks about if a man climaxes orgasms, then it's important for him to stay and make sure that the wife also mutually orgasms. And I think that those are very important things.
That's specifically more from like what we call adab al jima,
Okay.
sexual etiquette,
Okay.
in early
It's
Islamic
not from
literature.
that book. Yeah.
Yeah.
But I think the idea is still there
Yes,
that,
yes,
in
definitely. That
Islam,
idea of
the
emotional
concept,
intimacy, taking care of your wife's needs, not just physically but emotionally as well. I mean,
right.
we read a hadith about the Prophet noticing when one of his wives is upset without them telling them, "Tell me what's wrong," and then kind of coaxing them more. Is it have you is it your time? Have you reached your menses? And he doesn't leave them, right? He cuddles with them afterwards.
Right, right. No, I think that all of these things are so important. I think it's also important to realize that, for people that experience trauma, I think that it's important to understand that there is a way that you can go about moving past that, and for those that have a hard time with relationships to also build that emotional and physical intimacy with their partner. We know that, I don't know, have you heard of Rosemary Basson, who created the female sexual response cycle? And it's actually a circular model. I know that, I don't know if you remember, but we, in medical school, we learned the Masters and Johnson one, which is that linear model, right? Which
Mhm.
shows us about the excitement, the orgasm, the plateau, then the orgasm, then the resolution. But in Rosemary Basson's female sexual response cycle, she places a big emphasis on emotional intimacy as well as the sexual stimuli and how obviously women will experience. So what she did is in 2001, we didn't have the sexual response for women all throughout. And, as with most of medicine, right, all
Yeah,
of our research has been based on men. And
men.
so in 2001, she created this female sexual response cycle where she included, she talks a little bit about spontaneous desire, and she also talks about responsive desire, and stating that responsive desire happens more commonly in people that are in long-term relationships, and that it's not usually what is portrayed in the media where people are ripping off each other's clothes and this and that, but it's more that it's the emotional intimacy that also plays into it, and that oftentimes women will have a sexual stimuli, and then they will have either desire or arousal, either one or the other will come, and then they will become physically intimate with that partner. But if they have that emotional connection, then that physical connection is, it means more.
Yeah.
it results in a more sexually satisfying experience when they have that emotional intimacy. So I like how you also connect that with the emotional intimacy and how important it is to build that emotional intimacy with your partner and how that can help with things such as vaginismus or issues that we may be having when it comes to sex.
Yeah, in our traditional medical education, and in medical school and in traditional medicine, right now, even right now, like you
Mhm.
said, a lot of the focus is on the male sexual cycle. And even if you look at, big pharma and the
Of
data
course.
we have,
Yeah.
it's all around male orgasms. Even data, when they collect data in studies for sexual side effects of medications, it's actually based on male response,
Yes.
addressing males reaching sexual satisfaction. And if you look at the market, even for medication or treatments, it's based on men. And a lot of the models of sexual arousal and satisfaction we've learned is based on
Yes.
male sexual models. And I think one of the things that we don't become very aware of or teach people about is the idea of sexual satisfaction, how much it's linked to not just like having strong emotional connections, but for women feeling emotionally and psychologically safe.
Yes.
And that can definitely come with the safety of a relationship lasting a time, but it can also come be established very early on in a relationship if there's emphasis placed on making you feel emotionally cared for, making you feel emotionally safe, and things like building affection, building playfulness, building trust. These are very key things in having a very satisfying and healthy sexual life.
Yeah, no, absolutely. What would you say would be like a key component of whether it's cognitive behavioral therapy or working through the trauma that a patient has had? What do you think would be like a key step or ingredients to overcoming that trauma and, processing it and accepting it, but then also being able to move on?
Um, I think there's a lot of keys, but if I had to pick one, I think the idea of hope. I think I see a lot of women who really think it's not for them, or they're not somebody who can experience happiness and joy emotionally, and especially physically within marriage and within the relationship. The idea of hope, and going into whether you're in the beginning of a relationship or you're much later into your relationship, but there's always hope to really reframe your view and your experience of sex and your experience of intimacy.
Hmm. That's great. What would you say some of the other things are? You said that there were multiple, so I'd love to hear what the other things are.
I think the other thing is, I mentioned early on in terms of like the strong emotional, visceral reactions. One is fear, and the other one is shame. And that, that shame is, we know the shame is coupled a lot of times with sexual trauma in women, but it's also sometimes coupled with, in general, societies, whether it's, the Western society we've grown up in, or whether it's ideas that we may have from our culture of origin, the idea of shame around sex, and or shame around your own experiences in the past or your own traumas. And really being able to address those and really gaining strength, I think, through there's a spiritual dimension to sexual intimacy. The fact that it's given to us as a mercy, and it's given to us as a place of resting our hearts and resting our souls within each other. The way we see sex, we can reframe it spiritually and reframe it as there's a saying that it is sometimes Allah's way of giving us one experience of Jannah. And for a lot of women, that hasn't been the case with with sexual intimacy, and understanding that there is a purpose, and there is an intent for us to enjoy this, and that it is possible.
Mhm. I love the fact that you talk about hope because I agree. I think that a lot of times when women may be experiencing some type of sexual dysfunction, whether it's with arousal or orgasm or it's pain with intercourse, right? A lot of times women will come in with pain with intercourse. I think that that is oftentimes they've seen several providers and nobody's been able to help them. And so they start to lose hope that they can ever have a sexually satisfying experience, or that they'll ever be without pain, or that they'll ever be able to experience orgasm or such. And I think that being able to give people hope is one of the things that allows them to move forward with their relationships, but also in their sexual experiences. So I think that that really is key. And I think establishing, emotional intimacy that you spent a little bit of time on, I think is so important as well. What other things do you think might make cognitive behavioral therapy also important for somebody that's been experiencing sexual dysfunction for a long time?
Yeah, I think sometimes it's related to the relationship itself,
Yeah.
So and how what the dynamics are within that relationship, and what you've associated with intimacy within that relationship, and how secure you feel with your spouse. And so I think sometimes working on how you see the relationship, and the safety both of you feel within the relationship, and adjusting that, working on the relationship, can there's definitely like a holistic approach to this, right? A multifactorial approach. And I think working on the relationship can also be very, very helpful in terms of finding a more satisfying sexual experience.
Yeah. I wonder what would you tell the person that has grown up with sex negativity? I think a lot of people grow up with the idea that, sex is shameful, it's wrong, it's dirty, and you don't talk about it. And so when that happens, I think that people don't learn about it, right? And then perhaps the avenues that they may have to learn about, because they're so embarrassed, that they, either turn to porn or to other resources that may or may not be accurate. And I think that that also distorts their vision about what
Yeah.
sex is and what a satisfying sexual experience should be.
Yeah, and I think that porn especially can, I think can hold a lot of danger. And this is not just within our community, but even outside. Sometimes people get the impression that, if they have negative views about sex, or negative, or the sexual experience isn't satisfying, that porn is an avenue where they can maybe come back, get ideas, and it can maybe make the relationship healthier or strengthen it. And in reality, what it can actually be very detrimental to the real physical relationship, not just because of having like outside stimulus, but also because it gives very unrealistic
Yes.
and inaccurate ideas of what sex is.
Yeah.
And takes a lot of emotional intimacy out of it, and a lot of it is based on only, I think, one side. One side of the partners getting satisfied, but also, both men and women struggle with porn addictions, but it's much more common um, amongst men, and it can have a very negative impact in the real sexual relationship, in terms of expectations, but also genuine interest in each other, in terms of emotional intimacy and genuine, and it actually decreases a lot of times the sex drive outside of the porn aspect.
Sure, sure. And I think, when you talk about unreal expectations, I think also,
I always ask when people are having issues like this. I ask about the porn component, and
yeah,
very frequently it is an issue.
right, right. And I agree with you. I think that, when people
And it's
talk
very
about,
harmful when there's a partner watching the porn, and the other partner has it, especially the woman has a trauma history or a sex negative perception of sex. It actually worsens that.
right, right. Yeah, I can see that because, as we know, when with porn, it's like you're watching a show, right? It's like a whatever, a TV show or a Broadway show, whatever it is, because the actors aren't real. People, those people are acting. It's not real. It's just nothing about it is real. And so exactly what you say, when people then, they watch that porn and then they think that perhaps their sex life is going to look like that, which it definitely will not look like whatever it is that they're watching. um then it really causes a strain in the relationship. It causes a breakdown in communication. And then, if one person is watching it more than the other, or if the other person's not watching it at all, then it becomes, I think, shameful for the person that is watching it, and then they feel guilty. And there's so many things, there's so many components around it. And I think that, in the end, I don't know how much it is actually helping that relationship. And like you said, it may really be just harming it and making that relationship worse, where, it leads to more and more separation in the sense of any type of emotional connection between the two of them. And then, as we both talked about before, when you don't have that emotional intimacy, when you don't have that communication, when you don't have that connection, you're not going to want that physical intimacy.
Yeah.
Right. So, as we are finishing up, what if you were to give advice to somebody that's perhaps struggling with their sexuality, perhaps they grew up in a sex negative environment, perhaps they never even had any conversation about it, and they just don't know what to do, and they are experiencing a lot of these physical reactions anytime they start to become intimate, what would you tell them?
I think, if, for someone like that, the first message I want them to get out, if they get nothing out of this, the first message I want them to get out of this is that it can be very, very different. And that it's a very, looking at sex in a much more holistic way, and looking at sex as something that, we're entitled to sexual satisfaction. It is one of the rights of marriage for both partners, to be sexually satisfied. Because a lot of times we see it as a duty. And yes, if you think about it, it's the rights of each spouse. But on the other end, it's also it's a duty of each spouse to ensure the other person's physical and emotional security within that, right? So, not having a particular formula for what's expected out of a sexual relationship, but looking at the marriage relationship very early on to see how do we build this trust between us, and seeing sex as a tool to actually build that love and build that intimacy rather than separate from that. And taking it step by step in terms of focusing on on a woman's need for affection and a woman's need for playfulness, and both spouses and within a relationship have emotional needs, and making sure that you're serving the emotional needs of the other person. This
Right.
comes back to like exploring what their love language is, and really seeing how they express love to you, and expressing it back to them in the same way, caring for them, and accounting for their needs in the same way. And that all builds the sexual intimacy. That all builds in that bank account of trust between the two spouses.
Hmm. Yeah, I agree 100%. I think that, some easy ways for people, and you can tell me what you think as well. Some easy ways for people to build that emotional intimacy with their partner is just even going on a walk, right? Going
Yeah.
on a walk, holding hands, kissing, cuddling, right, on a couch, or
Mhm.
doing something experiential that builds that closeness. You could be cooking dinner together. You could be doing something that just is the two of you, and creates that emotional intimacy. There have been studies that have been done on mindfulness. Where do you think mindfulness plays into this with creating emotional intimacy?
Um, so, in terms of mindfulness, even going back to the cognitive behavioral approach to sexual intimacy, mindfulness can be very helpful in terms of kind of teaching yourself step by step the parts of emotional intimacy, and being present with each other when you're exploring intimacy. And sometimes like doing it gradually,
Mhm.
doing things that you may not even consider foreplay, but doing those things and stopping, and doing a little bit more next time and stopping. And just like we talk about sometimes eating, mindful eating, right? Doing it slowly, paying attention to the act. These are all very, very helpful.
Yeah. I don't know if you've heard of sensate focus, but sensate focus as it relates to intimacy is just that. It's a stepwise process where you
Yes, you
are.
touch slowly, and you each
Yeah.
day, even if you want to go further, you don't go further.
Correct. And
Yeah.
you're just touching for the sake of yourself for to
Mhm.
figure out, what it feels like for you. And I think that that modality is really important and very helpful for somebody, say that if they've never had intercourse, or they've experienced trauma, or all of those things, or any of those things. I think that sensate focus is a great modality to help somebody get back into self exploration, and also exploration of their partner, and getting used to the senses, and feeling what something feels like, tastes like, what you're hearing, and just really being in tune with your own body.
Yeah, and a lot of times when we talk to people about spending time on, one spouse and really like but exploring what they like, what they don't like, and expressing that. If you think about it, we don't use the same terms for that, but if you think about the psychological terms, you are becoming very, very aware of what you're experiencing, what you like, what you don't like, and the other partner really paying attention to that experience in that moment. And you can, take turns doing that, but especially placing emphasis on the woman's experience of it, and spending time, both partners spending time on your experience and what you like and what you don't like, and that is becoming very, very mindful instead of kind of going through it as a rote act, and doing only one part of it, like what touch feels good, what do I like, what do I don't not like. And it is very important to know and have an inventory in your mind of your spouse's preferences, and knowing that it changes over time, and kind of
Right.
having that time with each other so that you do know that. And idea of like dating your spouse always,
Yeah.
and really putting a lot of importance on that relationship. We
Yeah.
talk about how the marital relationship, especially once you become parents, knowing that you have to come back and strengthen that relationship above all other relationships, that children feel more secure in a family where the parents relationship is strong. It's like having, prioritizing that relationship. I also see a lot of traditional families where they say, okay, my role right now primarily is as a mother or as a father. And really, especially when the children are young, it's very tempting to say we have to prioritize that. But always remembering that the health of the family is, very very dependent on the health of the marriage and health of the family dynamics.
Right. I think that that's so important. And I think that really focusing on your relationship, right? In the end, that is what is going to make it stronger. And there have been studies that say that the most important aspect in a relationship is communication. So when
Yeah.
you feel safe enough to have an open communication with your partner, then that will only build that emotional intimacy and create a stronger relationship. So I think that's so important. And I think that goes very well with women that perhaps have experienced trauma in a relationship, or being sexually intimate with somebody in the past, to help them move forward in a new relationship or in their current one, and to feel safe and have that emotional intimacy grow. So
Yeah,
fantastic.
women feel very alone. Like whenever I talk with them, they think it's so unusual to have, a past marriage or a past sexual trauma that haunts them. And it's whether it's in the Muslim community or outside, this is the reality of being a woman in the world sometimes, unfortunately. And I think it's important to not feel alone, not feel like this experience is completely outside, and that you feel isolated for it. I think there to know that there's hope, and then there's
Yeah.
you can there's gynecologists who are experts in sexual health and trauma, and um, the experience the experiences can be helped with not just therapy, but also getting referrals to pelvic PT, and a lot of these other resources women don't hear a lot about.
Right. Right. Actually, that's, I agree with that 100%. I think that,
And
the,
pelvic PT, just like therapy, it's that gradual desensitization.
right.
It can be done
Right.
physically. It can be done. It's a very holistic approach.
Yeah, no, I think that the ideal triad for anyone experiencing any type of sexual dysfunction is to have a physician that's comfortable with sexual medicine, have a pelvic floor therapist, and then also see a sex therapist. And then I think that having those three individuals really helps in addressing the person's concerns in a holistic manner, because you're addressing that whole biopsychosocial component of sexual medicine. So I think that that's really
Exactly.
important.
And, I know a lot of people they come to me, like they've maybe expressed it to somebody, maybe like a male physician who said, there's not much we can do about that, or we don't know much about that. And it's not really true because it's just we just don't get exposed to it in our traditional training.
Right. Absolutely. Absolutely.
Yeah.
So, well, we are almost done here. So please tell the audience how they can get in touch with you. They've been listening to you and they're curious as to how they can work with you, how they can get in touch with you. So be great if you could let our audience know.
Yeah, and I also have a blog within my website too that I try to put out, and I do talks in the area. I do like teaching in general, and I do like talking about psychological wellness. So a lot of it, the connection can be made through my website, which is Peacetree Mental Health, which is my practice, and it's peacetreementalhealth.com. And you can even just Google my name, Sanjana Karim, and it should come up.
All
And
right.
I do see patients only in California right now, but hopefully I hope to put out, more educational material that's, a little bit more inclusive for everybody.
All right. Well, fantastic. Well, thank you so much for coming on. And it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you're having any issues with your sexual health or experiencing any type of sexual trauma and need help, please seek out a healthcare provider that can assist you. And until next time, this is the Muslim Sex Podcast.